My name is John Rice. About 5 or 6 years ago, I was sitting in the office here, felt very, very tired, and I started to slur my words. I called my doctor. He said, get to the emergency room as quickly as you can.
The second someone notices that they're having issues with slurred speech, blurry vision, weakness in one arm or one leg or both, we urge patients to go immediately to the hospital.
At Blake Hospital, we have a multidisciplinary stroke team that involves the emergency department, a team of neurologists. We also have a team of neurosurgeons that are on standby and available 24/7. And our interventional neuroradiology team is that will help get these patients to the care they need.
2 minutes of walking in the emergency room when I told them what was going on, they had me in the back and started working on me immediately.
Normally, in this scenario, patients would be started on blood thinners. He was originally tolerating the blood thinners just fine, and afterwards he ended up having issues with bleeding. And so that's what brought him in for our next step of procedures. We put an atrial appendage closure device. That process will allow us to cover up that appendage and decrease the amount of clots that can form there and subsequently go to the brain. And as a result, he can then come off of his blood thinner after a certain time.
The business is in my blood. It's what I do, what I've done for a long time. When I was laying in the hospital at Blake, it was a big concern, can I get back to work?
In his case, he's completely returned to full function. So the average person who sees him will look at him and would never even know that he had a stroke.
When you have to go to a hospital, you want to know that you're going to a place that you feel comfortable in, and so that's how I feel like I was fortunate to have a Blake Hospital here. I really appreciate the fact that they care about their patients. I've always had a wonderful experience.